The momentous occasion marks a significant landmark in cancer diagnostic and care in the Gambia. Cancer Week refers to anyone with a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate destroyed normal body tissue has been on a steady rise with its different types causing massive fatalities. Cancer often has the ability to spread throughout your body. Dr. Abubakar Jah, a senior member of C3G, highlighted that the organization aims to establish a palliative care center offering specialized medical care for people living with serious illnesses such as cancer or heart failure.
We in C3G aim to establish a palliative care center, and I want to say that this would be the first hospice in the Gambia or a palliative care center. And we will be reaching out to the Turkish embassy and to TICA and to QCell and our other donors to say that the Gambia needs a palliative care center. We need a center where if a patient is in their final stages, they will not die a demeaning death. They will die in honor and without pain. And how you can do that is not in the main hospitals, is in a hospice. And we are working hard to put up a proposal together, and we will be meeting our donors to get that done.
Omar Kah, Deputy Permanent Secretary at the Ministry of Health, hailed the initiative as a significant milestone in their efforts to confront and fight cancer and improve women's health and well-being in the country.
This event, marking the formal handing over of cervical cancer screening equipment and opening of a clinic, is a culmination of a thoughtful and sustained efforts from very concerned and committed institutions and individuals, but most importantly, C3G, TICA, and the Turkish government. For that, I express my infinite gratitude to you all. The items being handed over today, amounting to $20,375, including threats.
CEO of Bundung Maternal Hospital, Mamadi Cham, acknowledged C3G and TICA's effort, describing the handing over ceremony and clinic as a combination of thoughtful and sustainable work.
In commemoration of the annual fight against cancer slated for October, that was the turning point and motivation for this hospital to establish a clinic for routine breast and cervical cancer screening. That resulted us to mobilize some basic equipment and supplies, including the procurement of carbon dioxide cylinders to facilitate cryotherapy. From November 2022 to date, the clinic has been operational Mondays to Fridays. Up to 785 women were screened at the clinic.
Keba S. Bojang, Program Manager, National Cancer Control Program, said equipment handed over are mainly for screening and early detection of cervical cancer.
Fighting cancer is no easy feat. No one entity can do it, and it's much bigger than the Ministry of Health. And this is where civil society organizations, of which C3G is in cancer control, becomes important and comes to the fore. CSOs are an integral part of cancer control and are involved in all aspects of it at different levels all over the world: advocacy, capacity building, knowledge exchange, providing evidence-based information, coalition building, monitoring, and service provision.
Sule Bayer of TICA describes cervical cancer as the most common cancer at the moment globally. Cancer is the second leading cause of death in the world, but cervical rates are improving for many types of cancer, and the Ministry of Health is driving a collaborative campaign to combat cancer through screening and public education. For GRTS News, this is Zero Jalo reporting.